Hey folks, welcome back to Nurses Insiders. I'm your host, narrator's name, and I'm excited to dive into another compelling case study with you today. This one comes from a medical surgical nurse and really highlights the importance of a nurse's intuition and close observation. Our story centers on an 80-year-old woman who was admitted to the medical surgical floor from the emergency room. The ER team diagnosed her with a urinary tract infection, a fairly common ailment, especially in older adults.
When she arrived on the floor, she was alert and oriented, meaning she knew who she was, where she was, and the current date. You know, the basics.
However, things took a turn for the worse as the nurse started her rounds. The patient was now showing signs of confusion. She was disoriented and unable to walk without assistance. This was a significant change from her baseline condition just a few hours prior. Our nurse knew something wasn't right. Now you might be thinking, a UTI? Can that really cause such a dramatic shift in a patient's condition? Well, the answer is yes, especially in elderly patients. While UTIs are often perceived as minor inconveniences, they can quickly escalate into serious, even life-threatening situations. Older adults are particularly vulnerable to complications from UTIs because their immune systems aren't as robust as younger individuals. This means their bodies may not effectively fight off the infection, allowing it to spread and potentially leading to sepsis, a life-threatening condition. Sepsis occurs when the body's response to an infection triggers a chain reaction that can damage multiple organ systems. It's a serious medical emergency that requires prompt recognition and treatment. In this case, our nurse recognized that the patient's sudden confusion and inability to walk could be signs of something more serious than a simple UTI. This is where a nurse's intuition comes into play. Nurses are often the first line of defense in recognizing subtle changes in a patient's condition. They spend a significant amount of time with their patients, observing their behavior, monitoring their vital signs, and assessing their overall well-being. This close contact allows nurses to detect even the slightest deviations from a patient's baseline.
In this particular case, my gut feeling told me that something was amiss. The patient's sudden decline was alarming, and I knew I had to act quickly.
She immediately notified the physician on call about the patient's deteriorating condition. The doctor ordered a CT scan of the patient's head to rule out a stroke, as sudden confusion can be a symptom of a neurological event. While they waited for the CT results, the nurse continued to closely monitor the patient, keeping a watchful eye for any further deterioration.
Let's take a quick break, and we'll be right back to discuss what happened next.
The medical team, including our vigilant nurse, held their breath as the patient was taken for her CT scan. The possibility of a stroke was a frightening one, especially given the patient's age and the suddenness of her symptoms. A stroke could significantly complicate her recovery and potentially lead to long-term disabilities.
The minutes felt like hours as we awaited the results. I busied myself with other tasks, checking on my other patients, updating charts, and preparing medications. Yet my thoughts kept returning to the elderly woman with the UTI. Would the scan reveal a serious problem, or was there another explanation for her sudden decline?
Section 2, the waiting game.
Finally, the phone rang. It was the radiologist with the CT scan results. The news was good. There was no evidence of a stroke.
The nurse felt a wave of relief wash over her, but the relief was short-lived. If it wasn't a stroke, what was causing the patient's confusion and weakness? The mystery deepened, and the nurse knew they were in a race against time. Every minute counted in these situations. Early detection and treatment were crucial for a positive outcome.
She relayed the CT results to the physician, who then ordered a battery of blood tests, hoping to uncover the root cause of the patient's deteriorating condition.
Section 3, deterioration continues.
The nurse returned to the patient's room to draw the blood samples. As she approached the bedside, she was struck by the patient's appearance. Her skin was now clammy and pale, a stark contrast to the flushed complexion she had exhibited just hours earlier. Her breathing was shallow and rapid, her chest heaving with each breath.
The nurse's heart sank. These were classic signs of sepsis, a life-threatening complication of an infection. Sepsis occurs when the body's immune system overreacts to an infection, triggering a cascade of inflammatory responses that can damage organs and tissues. It is a medical emergency that requires immediate intervention. The nurse knew she didn't have a moment to lose.
She quickly took the patient's vital signs, confirming her suspicions. The patient's blood pressure was dangerously low, her heart rate was racing, and her temperature was elevated. The nurse immediately activated the hospital's rapid response team, a specialized group of healthcare professionals trained to handle medical emergencies.
Section 1. Rapid response.
The hospital corridors echoed with the hurried footsteps of the rapid response team as they rushed toward the patient's room. The urgency in their movements mirrored the gravity of the situation.
The nurse, her heart pounding in her chest, briefed the team on the patient's rapid decline, relaying the concerning vital signs and her suspicion of sepsis.
The room, once quiet and dimly lit, was now a flurry of activity. IV lines were quickly established, medications were administered, and oxygen was delivered through a mask placed over the patient's face. The team worked with practiced efficiency, each member aware of their role in this life or death situation.
The nurse watched intently as the rapid response team worked tirelessly to stabilize the patient.
Her own hands moved instinctively, assisting where needed, her training kicking in despite the adrenaline coursing through her veins.
She knew that every second counted in the fight against sepsis. The patient's blood was drawn and sent for immediate analysis, looking for signs of infection and organ dysfunction. Broad-spectrum antibiotics were started to combat the suspected sepsis even before the specific bacteria causing the infection could be identified. Time was of the essence. Despite the rapid response team's best efforts, the patient's condition continued to deteriorate. Her blood pressure remained dangerously low, her breathing became increasingly labored, and her confusion deepened.
She drifted in and out of consciousness, her frail body struggling to cope with the overwhelming infection ravaging her system.
The critical care physician, alerted to the patient's dire situation, arrived at the bedside. After a quick assessment, he made the decision to transfer the patient to the intensive care unit for more aggressive treatment and closer monitoring. The ICU, with its specialized equipment and highly trained staff, offered the best chance of survival for critically ill patients like this. The nurse helped to carefully transfer the patient onto the gurney, her heart heavy with a mix of concern and a strange sense of helplessness. She had done everything she could, but it might not be enough.
As the ICU team whisked the patient away, the nurse couldn't help but feel a sense of foreboding. The battle was far from over.
The patient's journey from a seemingly simple UTI to the brink of death was a stark reminder of the unpredictable nature of healthcare. It was a stark reminder of the importance of vigilance, critical thinking, and early intervention in nursing. The move to the ICU was a flurry of activity. Nurses and doctors swarmed around the patient, their faces etched with a focused intensity that spoke volumes about the gravity of the situation.
Our medical surgical nurse, though not directly involved in the patient's care anymore, couldn't help but linger outside the ICU doors, her heart heavy with worry. The sterile, brightly lit environment of the ICU was a stark contrast to the relative calm of the medical surgical floor. Here, every beep of a monitor, every hushed conversation, every hurried footstep was a stark reminder of the fragility of life.
Our nurse knew this environment well. Having worked a few shifts in the ICU during her orientation, she remembered the constant pressure, the emotional toll it took on the nurses, and the ever-present sense of urgency that permeated the air. The image of the elderly woman, her face pale and drawn, being wheeled through those doors, continued to replay in her mind. It was a harsh reminder that even the most routine medical conditions could escalate quickly, transforming from a manageable concern to a fight for survival. Inside the ICU, the fight to save the patient's life was in full swing. The critical care team worked tirelessly, their every action precise and deliberate. They monitored her vital signs closely, adjusting medications and therapies as needed.
The patient, now connected to a ventilator, lay still, her chest rising and falling rhythmically. A tangle of tubes and wires connected her to a myriad of machines. The scene was a stark reminder of the precarious balance between life and death.
Hours turned into days, and the patient's condition remained critical. The ICU nurses, with their unwavering dedication and expertise, continued to provide round-the-clock care, attending to her every need, monitoring her every breath, fighting tirelessly for her recovery.
Our medical surgical nurse, though back on her own floor, found herself frequently checking in with the ICU staff, seeking updates, clinging to any sliver of hope. Uncertainty hung heavy in the air, a palpable tension that settled over everyone involved. The medical team, despite their extensive knowledge and experience, could only do so much. They had employed all their skills, utilized the best available treatments, and yet the outcome remained uncertain.
The patient's fate, it seemed, lay precariously in the balance, a stark reminder of the limits of modern medicine, the humbling reality that sometimes, despite our best efforts, we are not in control. The waiting was the hardest part, the constant worry, the not knowing. Families gathered in waiting rooms, their faces etched with a mixture of hope and fear, clinging to the support of loved ones, drawing strength from shared prayers and whispered words of encouragement. Then, slowly, almost imperceptibly at first, a glimmer of hope emerged from the darkness.
The patient's vital signs began to stabilize, her breathing became less labored, and the cloud of confusion that had enveloped her mind seemed to lift slightly.
The medical team, cautiously optimistic, continued their vigilant watch, carefully adjusting medications and treatments, navigating the delicate tightrope between cautious optimism and the ever-present possibility of setbacks.
The news of the patient's slight improvement spread through the hospital like a much-needed ray of sunshine.
Our nurse, upon hearing the update, felt a wave of relief wash over her, a lightness replacing the heaviness that had been weighing on her heart.
It was a reminder in the midst of the constant battles fought within hospital walls that even the smallest victories were worth celebrating, that hope, however faint, should never be extinguished.
The patient's journey was far from over, the road to recovery likely long and arduous, but for now, there was a glimmer of hope, a reason to believe that she might just defy the odds and emerge from this ordeal stronger than before. This case underscores the critical role nurses play in patient care. Vigilance can mean the difference between a positive outcome and a tragic turn. Nurses are the eyes and ears of the medical team. They notice subtle changes in a patient's condition. Routine rounds are opportunities for careful observation. Truly seeing the patient can be life-saving. Minor details can be early warning signs. Recognizing subtle cues is a testament to nurses' skill and intuition. Finally, this case underscores the critical importance of clear and effective communication among healthcare providers. When a nurse observes a significant change in a patient's condition, it's essential that this information is relayed to the physician promptly and accurately. This communication should be concise, factual, and focused on the objective findings, while also conveying the nurse's level of concern. Using standardized communication tools, such as SBAR, Situation Background Assessment Recommendation, can help ensure that information is conveyed in a structured and efficient manner, reducing the risk of miscommunication or delays in treatment. Effective communication isn't just about conveying information, it's also about active listening, respecting each team member's expertise, and fostering a culture of open dialogue and collaboration. When healthcare providers work together as a team, sharing their knowledge, insights, and concerns, it creates the best possible environment for optimal patient care. This case carries universal lessons for nurses at all stages of their careers. Remember the power of vigilance, trusting your instincts, and clear communication. Your attention to detail and commitment to collaboration can make a difference. Nurses are often the unsung heroes of healthcare. Their dedication and expertise deserve our deepest respect. This video is for educational purposes only and doesn't constitute medical advice. Thanks for watching Nurses Insiders. Like, subscribe, and share. Leave a comment below. We appreciate your support.